Welcome to the Experience Better video podcast series. Today we're at Children's Rehab Center with Shelby O'Connor, occupational therapist, and Kai, who's he's about 14 months old, so we're going to talk a little bit about kind of maybe some 12-month milestones today. And so Shelby's going to give an OT perspective on what she's looking for and go over some things. So take it away.
So today we're going to focus more on like the fine motor, some cognition, and even some like self-care skills that Kai is showing most of them from what Josh and I kind of talked about. Some big ones you start to see is, like grasping of two items at once, mastering that transferring between hands we talked about. There you go, banging items together. You going to show us? You show us? Can you get the third one? Good job. Learning to point at items, do things for attention, following directions, some very simple directions. Can I have it?
Can you give it back? Good
Thank
job.
you. Yeah, can I have another one? Oh, do I get all of them? Do you want some back? Kind of starting to help with dressing, kind of trying to stick their arms and legs in, those sort of simple tasks they're going to start doing. Trying to take socks off, probably.
Yep, definitely.
I'll get those. Starting to show kind of around that 10-ish month, most babies, that stranger danger type things. Crying when mom and dad leave. But normally shortly after that, they're fine in their different environments throughout the day. Starting to kind of giving themselves their own bottle or sippy cup, and then also learning to drink from an open cup. Is kind of a skill that starts to get a little easier and less spills.
Yep, we've started
as they age. Yep,
we've started a little bit on the open cup, but
good throw. That was a good throw. Copying gestures, so if we clap, Kai might clap. Can you clap? Say patty cake, patty cake. He's like, there's so many other fun things. Can you play patty cake? Patty cake, baker's man. Can you do it?
So he has started to wave when we wave.
Oh, good job. Are you waving?
And started figuring out blowing kisses.
Do you do kisses?
Can you blow a kiss? You be shy?
We're being shy today, huh? Let's see. Also that, we talked about a little bit at that 9 months, that pincer grasp kind of starting to emerge. He should almost have it pretty much mastered now. You see it most like when they're eating things like Cheerios or smaller cut foods when you're transitioning to those table foods.
If you go over
Kai likes basketball. Learning kind of that cause and effect more. More. Can you pull it? Look. Can you get it? Pulling toys on a string.
Can you do it? Can you pull that string?
You're going to show us? Good job. Good. Did you get him? Yeah. Get him? They're really starting to master, which Emily, our PT, will talk about more. Their gross motor skills, your crawling, walking, sitting, all of those skills are getting more and more proficient as they age, which really helps them explore their environment and kind of establish those fine motor cognitive skills and the self-care skills we start to see. Should tolerate like toothbrushing and like combing hair, water over them in the bath. Yeah, clipping nails. Should tolerate and sit halfway decent for those.
Yeah, you like it. Your hair combed and your teeth brushed, and you help a little bit with it too.
There you go. That's perfect. Yeah. It's kind of those stage, a lot of places even recommend, looking into doing their first dental visit at between like a year and a half. A year and a half, I think, is what most pediatric dentists recommend. From a sensory standpoint too, it's great to kind of expose them to that environment and that sensation early on to help with your future visits and kind of help the children be aware of that.
Yay!
So from an OT standpoint, we can work on any of those fine motor, that grasp, the coordination, self-feeding, dressing, the big gross motor skills. Emily and I kind of work together if there's concerns in that area. Kai obviously gets around pretty well, don't you?
You want to walk? Should we show him? Let's show him.
You show him how you walk? Look at you! Oh my goodness! You're getting so big!
Good job, buddy.
Yeah. I think that's the main thing of what we have.
Very good.
Oh, we could show So at a year, we kind of start to see kids work on even those higher level fine motor skills. So Kai hasn't done much of it yet, but they'll start to fist a crayon, you know, and just scribble for fun. So that's a fun seated activity to try. Oh, look at you showing off. Look at that grasp. You're not even gonna fist it, are you? You're gonna color on the mat. Good job. So if there's anything, you know, with your child's development that you have concerns or questions on, we're always available for phone calls to answer simple questions over the phone and even get you in for an eval if that's something that you're interested in.
Excellent. All right. Well, thanks, Shelby.
Yeah, thank you.
All right.
Good job, Kai.
Yep.
You did so good.